The United States grapples with an insidious adversary, a silent killer that devastates lives: fentanyl. This synthetic opioid, exponentially more potent than heroin, has ignited a public health crisis. Its tendrils reach into every corner of the nation, leaving a trail of shattered families and overwhelmed healthcare systems. The fentanyl epidemic poses a grave threat to American society, demanding immediate action. We stand at a precipice, and the time for decisive intervention is now. The statistics paint a grim picture, revealing the sheer scale of this tragedy. Overdose deaths fueled by fentanyl have skyrocketed, claiming tens of thousands of lives annually. The crisis transcends demographics, affecting individuals from all walks of life. The human cost is immeasurable, leaving communities and families scarred by loss. The urgency of the situation cannot be overstated. This crisis demands a multifaceted approach, addressing addiction, border security, and supply chains. We must expand access to treatment and recovery services. The fight against fentanyl requires a collective effort. We must act now to stem the tide of this devastating epidemic. The fentanyl crisis is not just a public health issue, it is a national security threat. Combating this threat requires international cooperation and a coordinated strategy. The future of our nation depends on it. Fentanyl, a synthetic opioid analgesic, is approximately 50 to 100 times more potent than morphine and many times more potent than heroin. Its high potency makes it extremely dangerous, as even a minuscule dose can be fatal. Originally developed for medical use in pain management, particularly for cancer patients, fentanyl's illicit production and distribution have fueled the current crisis. The drug's potency and low cost make it an attractive option for drug traffickers. The origins of fentanyl can be traced back to 1959, when it was first synthesized by Paul Janssen. Initially intended for legitimate medical purposes, fentanyl quickly became a target for illicit manufacturing and distribution due to its powerful analgesic properties. The rise of clandestine laboratories producing fentanyl analogs, often with varying potencies and unknown chemical compositions, has further exacerbated the crisis. This poses significant challenges for law enforcement and healthcare professionals. The dangers of fentanyl are compounded by its ability to be easily disguised and mixed with other drugs. Often, individuals unknowingly consume fentanyl when it is laced into counterfeit prescription pills or other illicit substances. This unwitting exposure contributes significantly to the high number of overdose deaths. The lack of awareness about the presence of fentanyl in other drugs further underscores the need for public education campaigns. The highly addictive nature of fentanyl makes it exceptionally challenging for individuals to overcome their dependence. Withdrawal symptoms can be severe, and relapse rates are high. This underscores the need for readily available and accessible treatment options, including medication-assisted treatment and comprehensive support services. Addressing the underlying causes of addiction, such as trauma, mental health issues, and socioeconomic factors, is also crucial. Fentanyl enters the United States through a complex network of smuggling routes, primarily orchestrated by transnational criminal organizations. These organizations exploit vulnerabilities in border security, utilizing sophisticated methods to evade detection. The porous nature of the US-Mexico border serves as a major entry point for fentanyl. The sheer volume of cross-border traffic poses a significant challenge for law enforcement agencies. The involvement of Mexican cartels, such as the Sinaloa cartel, plays a crucial role in the fentanyl trade. These cartels control vast networks of production and distribution, leveraging their established infrastructure to move fentanyl across the border. Their sophisticated tactics, including the use of tunnels, drones, and maritime vessels, make interdiction efforts increasingly complex. The cartel's financial resources and influence further complicate the fight against fentanyl trafficking. The precursor chemicals used in fentanyl production are often sourced from countries like China and India. These chemicals are then shipped to clandestine laboratories in Mexico, where they are synthesized into fentanyl. The lack of regulatory oversight in some source countries facilitates the diversion of these chemicals for illicit purposes. International cooperation is essential to disrupt the supply chain and prevent the flow of precursor chemicals into the hands of criminal organizations. The internet and social media platforms have become increasingly important tools for fentanyl traffickers. These platforms provide a convenient and anonymous means of connecting buyers and sellers. The dark web in particular facilitates the illicit trade of fentanyl, allowing transactions to occur outside the reach of traditional law enforcement surveillance. Addressing the online dimension of the fentanyl trade requires innovative strategies and collaboration with technology companies. Section 4. Genesis of a crisis. Untangling the Roots. The current fentanyl crisis is deeply intertwined with the legacy of the opioid epidemic, which ravaged communities across the United States for decades. The overprescription of opioid painkillers created a generation of individuals dependent on these powerful drugs. As access to prescription opioids became more restricted, many individuals turned to the illicit market, seeking alternative sources to satisfy their addiction. This created a fertile ground for the proliferation of fentanyl. Social media plays a significant role in the fentanyl crisis, particularly among young people. Platforms like Snapchat and Instagram are often used to facilitate drug transactions. The anonymity and ease of communication offered by these platforms make them attractive to both buyers and sellers. The lack of effective oversight and regulation of online drug markets contributes to the accessibility of fentanyl. Economic factors, including poverty, unemployment, and lack of access to healthcare, contribute to the vulnerability of individuals to substance abuse. In communities struggling with economic hardship, drug use can become a coping mechanism for dealing with stress, trauma, and despair. Addressing the underlying socio-economic factors that contribute to addiction is crucial for preventing future crises. The COVID-19 pandemic exacerbated the fentanyl crisis, creating a perfect storm of conditions that fueled increased drug use and overdose deaths. Social isolation, economic hardship, and disruptions to healthcare services contributed to a surge in substance abuse. The pandemic also highlighted the fragility of the mental health system and the need for increased access to treatment and support services. Section 5. Societal fallout, ripple effects of despair. The fentanyl crisis has had a devastating impact on American society, leaving a trail of destruction in its wake. Overdose deaths have skyrocketed, claiming the lives of tens of thousands of individuals each year. These deaths represent a profound loss to families, communities, and the nation as a whole. The human cost of the fentanyl crisis is immeasurable. The strain on healthcare systems is immense. Emergency rooms are overwhelmed with overdose cases, stretching resources thin and diverting attention from other critical medical needs. The cost of treating addiction and overdose is staggering, placing a significant burden on taxpayers. The fentanyl crisis represents a public health emergency that demands immediate and sustained attention. The rising crime associated with the fentanyl trade is another alarming consequence of the crisis. Drug trafficking fuels violence, gang activity, and other criminal enterprises. Communities plagued by fentanyl trafficking experience increased rates of property crime, violent crime, and social unrest. Addressing the criminal element associated with fentanyl requires a coordinated law enforcement response. The fentanyl crisis poses a national security threat, with links to transnational criminal organizations and the potential for destabilization in source and transit countries. The illicit production and trafficking of fentanyl undermines the rule of law and threatens the stability of international borders. Combating this threat requires international cooperation and a comprehensive strategy to disrupt criminal networks. Section 6. Governmental response, a race against time. The United States government has implemented various measures to combat the fentanyl crisis, recognizing the urgent need for a comprehensive response. These efforts include increased funding for law enforcement agencies to enhance border security, interdiction efforts, and investigations into drug trafficking organizations. However, the scale and complexity of the crisis demand further action. The government has also focused on expanding access to treatment and recovery services. This includes initiatives to increase the availability of medication-assisted treatment, which has proven effective in helping individuals overcome opioid addiction. However, significant barriers to accessing treatment remain, including cost, stigma, and lack of available services in many communities. Public awareness campaigns have been launched to educate individuals about the dangers of fentanyl and the importance of seeking help for addiction. These campaigns aim to reduce stigma surrounding addiction and encourage individuals to seek treatment. However, more needs to be done to reach vulnerable populations and effectively communicate the risks associated with fentanyl use. The government has engaged in international collaborations to address the global dimensions of the fentanyl crisis. This includes working with other countries to disrupt the supply chain of precursor chemicals used in fentanyl production and to dismantle transnational criminal organizations involved in drug trafficking. However, international cooperation can be challenging due to political and economic factors. Section 7. Charting a course forward, multifaceted solutions. Strengthening border security is a crucial component of combating the fentanyl crisis. This includes enhancing surveillance technologies, increasing the number of border patrol agents, and improving infrastructure at ports of entry. However, border security alone is not sufficient to address the root causes of the crisis. Holding social media companies accountable for their role in facilitating drug transactions is essential. This includes requiring social media platforms to implement more effective measures to identify and remove content related to drug sales and to cooperate with law enforcement investigations. Increased regulation and oversight of online drug markets are necessary. Expanding access to treatment and recovery services is critical for helping individuals overcome addiction and reclaim their lives. This includes increasing funding for treatment programs, removing barriers to accessing care, and promoting evidence-based treatment approaches such as medication-assisted treatment. Addressing the underlying causes of addiction, such as trauma, mental health issues, and socioeconomic factors, is also crucial. Implementing harm reduction strategies, such as naloxone distribution programs, can save lives by reversing opioid overdoses. Naloxone is a medication that can quickly reverse the effects of an opioid overdose. Making naloxone widely available to first responders, community members, and individuals at risk of overdose can significantly reduce overdose deaths.